We'll discuss about Staphylococcus. Staphylococcus is gram-positive cocci in cluster. Why do we say them in cluster? Because the daughter cells divide in a multiple plane and they are unable to separate from the parent cell. So we see them in the cluster. So you see gram-positive cocci in cluster. Gram-positive cocci we divide on the basis of catalase test. If they are catalase positive, we say put them in the Staphylococcus. If they are catalase negative, they are Streptococcus. Catalase positive organism further classified on the basis of fermentation of glucose. If they don't ferment the glucose, we put them in Micrococcus and Planococcus. If they ferment the glucose, they are Staphylococcus. Staphylococcus is further classified on the basis of coagulase test. If they are coagulase positive, they are Staphylococcus aureus. If they are coagulase negative, they are Staphylococcus epidermidis or Staphylococcus saprophyticus. Okay. So this is the detail about your Staphylococcus. You can see the catalase test. This is the test which we do to differentiate Staphylococcus from Streptococcus. So in catalase test, you use 3% of hydrogen peroxide. Okay. So you put few drops of 3% hydrogen peroxide and inoculate the organism. If you see the brisk effervescence immediately because of release of nascent oxygen, that is catalase positive. If that doesn't happen, it's catalase negative. Same way when you do in a tube, you say it as a tube catalase test. So in tube also you will say similar way, release of nascent oxygen because of catalase enzyme breaks down hydrogen peroxide into water and nascent oxygen and you get the effervescence. So they are catalase positive. If you don't get the effervescence, they are catalase negative. What are the virulence factor of Staphylococcus? So there are cell wall associated factors and you have toxins, enzymes are there. So we'll start with cell wall associated factor which is responsible for virulence of Staphylococcus, that is peptidoglycan. As Staphylococcus is gram-positive cocci, they will have thick peptidoglycan layer and they will have teichoic acid. This teichoic acid will help in adhesion of bacteria as well as inhibit the phagocytosis. They have cell wall associated clumping factors, okay, which help in fibrinogen binding. So that will make a clump or a fibrin clot around the bacteria and help in the survival of the bacteria. Then they have protein A, which will act as an anti-complementary, inhibit the opsonization, chemotactic factor, and it will bind to the Fc IgG. So Fab portion will be free to bind different antigen. So that is the protein A and this phenomenon is called co-agglutination. Earlier we used to do this for the classification of Staphylococcus or identification of Staphylococcus. This is no more done. And this phenomenon of that binding to Fc IgG, so Fab is free to bind different antigen, was your protein A was used. Then you have membrane active toxins. So what are the toxins you see in Staphylococcus? You have hemolysin, alpha, beta, gamma, delta hemolysins, which will form the pores in the cell and causes lysis of the cell. Then you have dermonecrotic, cytotoxic, leukocidal toxins. This leucocidine is also called as Panton-Valentine toxin and this will act synergistically with gamma hemolysin. So this gamma hemolysin and this Panton-Valentine toxin will act synergistically. This is called synergohymenotropic toxins. Now you have epidermolytic toxin or exfoliative toxins. We'll see the clinical feature of this.